Hello again, everybody. This is Dr. Rob Lindsay, and today we're going to talk about autoimmune treatment success number 10. This is about vitamin D. Now, you always seem to hear in the news that there's some new vitamin to consider or new deficiency to consider, but when it comes to autoimmune disease, and specifically Hashimoto's or any other autoimmune disease, it's very important that the patients are taking vitamin D to help their immune system. Modern diets are lacking in vitamin D rich foods, okay, plain and simple. So what are vitamin D rich foods? Well, liver, okay? Now to be honest with you, I can't stand liver, okay, but it's important. Other organ meats, lard, many forms of seafood, butter, and eggs, egg yolks especially. Remember what I said about eating eggs for breakfast and how important it is for your blood glucose levels? Okay, also it's got good vitamin D. Sunlight is another important factor and source of vitamin D, but you should never take vitamin D without having your vitamin D levels tested. Specifically, 25 OHD and 125 OHD. Most MDs will only test 25 OHD, but it's very important to have both levels tested. This way, you're eliminating the guesswork. You could be low in vitamin D or on the low side of normal. Either finding would constitute a different recommended dosage. Why is vitamin D so important? Well, vitamin D deficiency is associated with many autoimmune conditions, including Hashimoto's thyroiditis, including lupus, rheumatoid arthritis, MS, you name it. Vitamin D is associated. Frankly, autoimmune rates have been skyrocketing in the past 20 years, which correlates with the decreased levels of vitamin D in the general population. Adequate vitamin D levels help to keep the immune system in balance so it doesn't swing out of control into an autoimmune disease. When it comes to autoimmune disease, the problem with vitamin D deficiencies are made worse by genetics. There are studies that show that more than 90% of people with an autoimmune thyroid or Hashimoto's have a genetic defect affecting their ability to process vitamin D. Therefore, many people, especially these people who have this issue, need higher amounts of vitamin D to maintain health, even if their blood test shows sufficient vitamin D. In many cases, patients will come into my office and their vitamin D levels will be on the low side of normal, and their MD has told them that you're fine, okay? There's nothing wrong with you. When actually, if you're on the low side of normal, you need to be supplementing with vitamin D. I recommend that all my patients with any thyroid or any autoimmune condition take extra vitamin D. Again, we've said this over and over. You need to just make an appointment. You need to just come in and let us check you, 952-949-0676. Let's see if we can help you out. Have a great day, and we'll see you on our next Thyroid Success treatment.